And sadly, we know there's not a cure for scleroderma per se, but what are some of the treatment options that you will offer to your patients?
So for the most part, my patients are actually usually spared immunosuppression because the studies that we have done show unless their disease is severe, they don't seem to respond much to immunosuppression. If we do, we tend to use a medicine called Cellcept. There's one called cyclophosphamide. There are some newer drugs on the market that are kind of being experimented with. I've got a few patients trying those out, and so far I've seen really beautiful results. So I'm keeping my fingers crossed for those patients. But for the most part, treating scleroderma is band-aiding the symptoms. There are a few new drugs out for lung involvement, particularly that high blood pressure or the fibrosis of the lungs. But for the most part, if they're having bad heartburn, I send them to someone like Carrie. And we see, do they need dilation of that esophagus? Do they need higher dose medications to help with heartburn? Do they need a lung transplant? Do they need oxygen at nighttime? And so that's the really unfortunate part of this disease, is there is no cure. There doesn't seem to be a way to slow it down. We just band-aid the symptoms.